Fine.
Hi, everyone. As she said, my name is John Rissler, and I'm very glad to be with you all today. I'm glad to know traffic wasn't too bad and you got a good parking spot.
Yeah, right.
Oops.
Uh-oh.
Yep. Well, that's my first slide. That's a good thing. I will be saying slide so that she knows when to turn the slides. I don't have a magic clicker. And we'd like to have your questions in the chat, and we can answer them later if they come up, if there are any. But that let the programs flow better and not interrupt. So thank you for giving me a few minutes of your time. The SHINE program, as she said, serving the health insurance needs of elders, is affiliated with the Florida State Health Insurance Assistance Program. And the Senior Medicare Patrol is now aligned with it. In today's presentation, I'm going to share information about fraud and abuse and how they affect you, and how you can take charge to help prevent fraud and abuse in 3 easy steps: protect, detect, and report. Slide, please. SHINE is a program of the Florida Department of Elder Affairs. The SHINE program is part of a nationwide state health insurance assistant programs, or SHIP. There are SHIP programs in all 50 states and 4 U.S. territories. So when we're dealing with people who come to Florida for 6 months out of the year or are moving here in retirement, they're used to the term SHIP. We already had a SHIP, so we had to have a SHINE. The Florida Department of Elder Affairs receives annual funding for the SHINE program from a Florida SHIP grant. And their vision is that all Floridians aging with dignity, purpose, and independence. The SHINE mission is to provide free, unbiased information about Medicare and Medicaid. SHINE also educates beneficiaries to protect, detect, and report potential errors, fraud, and abuse with their Medicare coverage. Specially trained volunteers will assist beneficiaries, their families, or caregivers regarding their health insurance needs either over the phone, via the internet, or in a one-on-one counseling session at one of our partner sites. SHINE services are free, they're confidential, they're unbiased. In addition, the SHINE program offers assistance in completing applications for the following. I'm trying to avoid all the alphabet soup today, but the Medicare Savings Programs, or MSP, that helps to pay for Medicare for low-income people. And LIS, or Low Income Subsidy, it's known as Extra Help, and it reduces the cost of your Medicare prescription drugs. The SMP mission is to empower and assist Medicare beneficiaries, their families, and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse through outreach, which we're doing today, through counseling and education. Slide, please. SHINE is a free program offered by the Florida Department of Elder Affairs in partnership with your local Aging and Disability Resource Center. Specially trained volunteers can assist you with your Medicare, Medicaid, and health insurance questions by providing one-on-one counseling and information. SHINE services are free, unbiased, and confidential. SHINE is not affiliated with, nor does it endorse, any insurance company or product. That last bit was thanks to the lawyers. Okay, next slide, please. Aging and Disability Resource Centers, or ADRCs, are located in the 11 areas in Florida. The centers are independent, they're not-for-profit organizations, and they're responsible for ensuring the availability of services to all elders in Florida. The SHINE program contracts annually with the Aging and Disability Resource Centers to provide counseling services locally. Slide, please. The primary duty of volunteer SHINE counselors is to help Floridans identify, understand, compare, or enroll in original Medicare, Medicare Advantage plans, Medicare prescription drug coverage, Medicare supplement insurance or Medigap, low-income subsidy extra help for prescription drugs, Medicare savings programs. We handle Medicare fraud and abuse, Medicare savings programs, long-term care planning, and Medicare complaints and appeals. It's a full plate and requires many hours of computer training. We also share at quarterly meetings our experiences, and we help each other in this task. Slide, please. So how many of you are Medicare beneficiaries? You can raise your hands. I can't see them all, but you can do that if it gives you a bit of exercise. How many of you are caregivers? How many of you pay taxes? Now I think I got you all of that one. You all know taxes. So you might be wondering why you or I should care about Medicare fraud. Well, Medicare fraud, errors, and abuse affect everyone. Each year, Medicare loses billions, with a B, of taxpayer dollars to improper claims. This puts the Medicare Trust Fund at risk for everyone and affects the future of the Medicare program. Medicare fraud, errors, and abuse also affect current Medicare beneficiaries because they result in higher Medicare premiums and waste money that could be used to increase and improve healthcare services. Slide, please. Fraud, errors, and abuse can also cause serious personal consequences for beneficiaries, such as medical identity theft, negative health impacts, and personal financial losses. Medical identity theft occurs when a beneficiary's Medicare number is misused, either by a provider, a supplier, or someone posing as the real beneficiary in order to receive medical care. Such Medicare numbers are considered compromised. You see, Medicare numbers are for life, even if stolen or misused. So a beneficiary whose number is compromised may be affected forever by false claims against his or her Medicare number. What are the health impacts? Receiving health care from a fraudulent provider can mean the quality of the care is poor. The intervention is not medically necessary, or worse, it could be harmful. The beneficiary may later receive improper medical treatment from legitimate providers as a result of inaccurate medical reports. Additionally, because of inaccurate or fraudulent claims to Medicare, beneficiaries may be denied needed Medicare benefits. Personal financial losses can also occur because Medicare numbers are as valuable as Social Security numbers to thieves. They wish to set up credit card accounts with someone else's identity. Financial fraud can be a side effect of having one's Medicare number compromised. Also, there may be legal consequences for some beneficiaries who are complicit in fraud and abuse, since participating in schemes to defraud Medicare is illegal. Next slide, please. Well, the Senior Medicare Patrol is here to help you avoid those problems. The SMPs help Medicare and Medicaid beneficiaries prevent, detect, and report healthcare fraud. And by doing so, we help to preserve the integrity of the Medicare and Medicaid programs. Because this work often requires face-to-face contact to be most effective, SMPs nationwide rely on approximately 5,000 volunteers who are active each year to help in this effort. Since Florida is the #1 state for Medicare fraud, we have over 500 Medicare SMP volunteers through the SHINE program here in the state of Florida. Slide, please. Now that we've learned a little bit about Medicare, let's take a look at Medicare fraud. Medicare fraud involves intentionally billing Medicare for services that weren't received, or billing for a service at a higher rate that is actually justified. On what is Medicare abuse? Next slide, please. Providers supply services or products that are not medically necessary or that do not meet professional standards. I personally had a case like this in Clay County where a podiatrist supplied braces, special shoes, and a boot that were totally unnecessary and were totally uncomfortable, and the patient never left the office with them, but they were billed to Medicare anyway. So that's #1 here. Billing for excessive medical supplies. This scam involves durable medical equipment, particularly braces. A client would receive a call on the phone offering a free Medicare paid for back brace. The next thing you know, 2 back braces, 3 knee braces, and an elbow brace start appearing on the front porch delivered by UPS. Okay? Medicare's billed for all of those. The people didn't want them. They didn't really need them. And that can go on for quite some time unless the person reports it. Obtaining or giving a Medicare number for free services. Okay? As you probably know in the business, Medicare is not free, which is a shock to some people retiring who thought it was. Improper coding to obtain a higher payment. This occurs in fraudulent insurance claim offices in Medicare providers. Sometimes the improper coding is abuse. Sometimes it is a normal error. There are somewhere in excess of 70,000 codes for each specific treatment given in a medical world, and sometimes the Medicare coder can get the wrong one. Unneeded or excessive x-rays and lab tests. This is when people are repeatedly sent for blood work or x-rays, MRIs, and CAT scans. Claims for services that are not medically necessary. So people who are in because they have reflux end up with hearing tests on their bill. And using another person's Medicare number or letting someone else use your number is also fraud and abuse. This often occurs in areas where the poverty level is at a point where only the retired or 66 or 7-year-old has Medicare and no one else in the family has medical insurance. They may try to use their card. Slide, please. So a couple of real-life cases. In March of 2018, a prominent South Florida eye doctor received a 17-year sentence for stealing $73 million from Medicare by persuading elderly patients to undergo excruciating tests and treatments they didn't need for diseases they didn't have. Dr. Solomon Melgan was convicted of 67 crimes, including healthcare fraud, submitting false claims, and falsifying records. An SMP counselor was involved at the initial stages of that case. And I emphasize, we're not investigators. We gather information and we turn it over to the Office of Inspector General of the Health and Human Services Department. It's sometimes then shared with the FBI. They're the investigators. They have the ability to build a case. But we can supply an awful lot of information. A more famous incident occurred last summer when 35 people in 6 states were arrested in a fraud, including 5 doctors here in Florida. Almost all medical bills to Medicare require a doctor's okay, a doctor's order. And these doctors sit in their family room watching football, signing one order after another for hundreds of dollars per signature. And that's how they get caught doing the wrong thing here. Those are just a couple examples, and we'll move on to the next slide. So we've mentioned this before. You can take charge and help prevent Medicare fraud, errors, and abuse. And here are the 3 easy steps: protect, detect, and report. And we'll go into some detail starting with the next slide. First, you want to protect yourself and your loved ones. Do treat your Medicare and Social Security cards and numbers like your credit card. Don't give out your Medicare number except to your doctor or other Medicare provider. Don't carry your Medicare card unless you will need it. Only take it to doctor's appointments, visits to your hospital or clinic, and trips to the pharmacy. Many of my beneficiaries put them in a separate wallet or a separate folder. Their Medicare card, their insurance card, their Social Security card, and leave them at home. Not to worry, if you go to an ER, they will treat you first and ask for paperwork later. Do watch out for identity theft. Scam artists will not only use your Medicare number, but it's one way they can steal your identity. Do be aware that Medicare does not call or visit to sell you anything. They may have their contractors call from time to time, so you need to be vigilant. Keep in mind that you don't have to talk to anyone who calls you or shows up at your door. Medicare contractors usually understand. One of the difficulties we as counselors have when making phone contact with people who've requested help is that we're calling from our own personal phones, which are often cell phones. Mine has a California area code. And so a lot of people, it goes to voicemail. And so we leave a message and they call us back. So there are people out there being very careful with phone numbers that they don't know. Be cautious of offers for free medical services. One of the scams that's been popular in Florida for the last couple of years is the DNA swab scam. It's usually perpetrated at a medical medical health fair. They'll have a table, a couple of guys in scrubs, and they'll offer to swab your cheek and let you know if you're going to get a certain kind of cancer or perhaps be allergic to certain drugs. And Medicare will pay for it. Just give me your number, swab your cheek, put it in this test tube, and we'll take care of it, and you'll get a report in 3 to 4 weeks. Well, after they've finished, they go home, they throw them all in the trash, but they count them and report how many, and they get paid based on how many they swab. And some of the scams are paying $300 to $400 per swab. Most of the people doing it don't really know it's a scam. They actually mail them to an address, and that's where they go in the trash. Okay, slide please. So how can you detect fraud and abuse? Even when you do everything right, there's a chance you could be a target. There are many ways that your personal information can be used without your permission. So you need to record doctor visits, tests, and procedures in a personal health care journal or a calendar. Always review your Medicare summary notice and explanation of benefits for mistakes. You're going to look for 3 things there and on your billing statements. You look for charges of something you didn't receive. In my case, it's charges for things I don't know what the word means, but you have to work on that. Billing for the same thing twice, and services that were not ordered by your doctor. That's this charge for the hearing test when you had acid reflux and the coder in the back room is in on the scam, but the doctor may not be. Then you want to compare these notices and other statements with your personal health care journal and your prescription drug receipts to make sure that they match, so that you don't have a charge for an appointment that your calendar says was canceled. Access to your current Medicare account is available 24 hours a day. So you don't have to wait for the Medicare summary notices to be mailed to you once a quarter. You can actually go online at www.mymedicare.gov and build your Medicare account. For those of our clients who are less computer savvy, we as counselors, with their permission, can help them do that. Slide, please. Report, the final step. If you detect fraud or abuse, report it. You'll protect other people from becoming victims. You'll help to save your Medicare benefits. So to report your concern, first if you have questions about information on your Medicare summary notice or EOB, call the provider. Call the insurance person in the back room. Plan to find out if it was an error, if they can correct it without taking any further action on your part. As I said, there are a lot of different codes. Confusion reigns sometimes. Even a slip of a finger off a key, and you got a charge for something that you didn't have. If you're not satisfied with the response you get, or maybe you're not comfortable calling your provider or plan, gather all the facts that you can about your situation. I also tell my beneficiaries, don't call the doctor. Most doctors know very little about what kind of insurance coverage they take and how the billing system works in the back. Especially now that hospitals are buying up medical practices and combining them into massive data systems. You want to make sure you have your MSN or EOB and any other supporting documentation that shows the possible fraud or abuse. If you can get records from your provider, they can print them out, email them to you, fax them to you, mail them to you. You get all that together, then you want to contact us, the SMP, if you need help. Keep in mind that the services provided by us are free and confidential. We treat all your medical information under the HIPAA rules, and what goes into the legal authorities is going to be combined with information from dozens of people, so you're not going to be the single witness, and there's nothing to fear there. So just to summarize on the next slide, we need to protect our Medicare numbers. We need to detect fraud by watching what's going on in our accounts, and we need to report that to the SMP. Let us then worry about which federal offices need or state offices need to be notified. So now I'm a little sales pitch. Now that you've learned how to protect, prevent, and report Medicare fraud, errors, and abuse, how'd you like to help other people? Volunteers like me give group presentations like this one. We really prefer to do it in person, and hopefully soon we'll be able to do that. We also provide individual counseling. We do a lot of it by phone. We do some through email, some a combination, even some by regular mail. Anyway, we get good training, extensive training, and updates all the time. And if you'd like to join the SMP program as a volunteer, you can call Carrie or talk to Linda, and we can get you signed up for a training class. Next slide, please. Okay. This is our statewide elder hotline number. We have a local one that I hope Carrie's going to give at the end. And again, we can help seniors enroll in Medicare, Medicare Advantage plans, Medicare prescription drug coverage, Medigap supplemental policies. We can help them with low-income subsidies, Medicare savings programs that will save them money. We can give some help and guidance in long-term care planning, although I must say a senior who's looking into that, it's a little late. The premiums are almost prohibitive. And we also handle other public and private health insurance issues. We can deal with providers and government agencies of all sorts. So that's the story of SHINE and the Senior Medicare Patrol. I appreciate your attention today, and I'd be willing to answer any questions you might have.
John?
Yes.
I remember one of the presentations you did where you talked about the DNA swab. And besides the patient, the Medicare beneficiary not getting results and it really not being needed and the financial ripoff to Medicare, you shared another fact, which I thought was very interesting, about the lifetime benefit of getting a DNA test. And now that they had it and it was billed under their number, if I recall correctly, if they ever needed that test now later or legitimately, they would not be able to get that test. Is that correct? Did I get that right?
Yeah, that's correct. Medicare does genetic testing for one specific cancer situation once in a lifetime. And if you have used, if you were charged improperly for that, and you go to, and you need it later, you can't get it. I'm dealing with a couple they're from Ponte Vedra. I won't mention names, of course. And I turned all the data in, we did the research. We found this phony lab in Texas. With Google Earth, you can fly in there and take pictures of the building. And you can send and find pictures of the owners' homes in St. Petersburg and other places. It's interesting because a couple of weeks ago in the Wall Street Journal, there was an article about a COVID-19 testing scam. And the principal, who was discovered by the reporter outside the same warehouse that they were doing the DNA swabbing, I recognized the name. And so I've called back to the couple in Ponte Vedra because they had not received their MSNs. They have now both been charged for that test. And so we're going to have to get their MSNs and work with Medicare to try and get that reversed. But you're right, it's a one-time deal, and it's a shame what they're doing.
Yeah, it's terrible. Did anybody have any questions for John? Any comments? Maybe you all have come across it with your clients. I know the presentation is geared towards people with Medicare, but this is really good information for you to bring back to your clients who are the beneficiaries. So I hope the information is helpful for you to be able to do that. But are there questions that John or Carrie can answer for you when you do talk to your clientele, or things you may have heard from your clientele that maybe we can help with answering? Carrie, did you want to do the poll now? Because Jessica showed me that how it could be seen on the screen. Carrie, are you on mute?
Yeah, if you can, please.
So what do? I hit the launch polling, Jessica, or you do it?
Yes, yes.
I do it? Okay. So we'll launch the poll. So have you ever been a fraud victim? Can everyone see that now? Oh, yes, you are voting. I'm learning something new. 7 out of 12.
Is there only one question?
So far, there's one question. Do I end the polling, Jessica? Okay, she's nodding yes. And we have, do I do share results?
Yes.
Okay. And so someone had been a victim of fraud. Okay. And the majority of us have not, but I know we all have clients who have. Do I stop sharing results now?
Yeah. We wanted to do that at the beginning to get a feel, how many had an encounter with fraud.
Yeah.
And I touched that in these days, especially with the COVID, we've heard terrible frauds that are going out there. People are even knocking on doors of the elderly and offering tests, which are not, the tests are not really happening. It's just a fraud. They're calling people and offering to come over and do the test. Usually they do it by phone, but they're getting so aggressive that they're even knocking on people's door and offering COVID tests. They're also calling people to offer to get them the stimulus checks. There's so many frauds since this pandemic happened and they're going so fast. And like John shared, between California and Florida, we take turns in being the first and the second place in fraud. So we're in the hot spot in fraud. So, I mean, like advocates out there for the seniors, we really have to keep our eyes open every day for the new ones that are coming out. So right there, we had our phone number for the Shine. If any of you are interested in becoming one of our valuable volunteers, you're welcome to call us. And if you need more information, we can also share it. My email is there. And also you can reach us through Linda.
And Carrie, if they wanted to send anything out to their clients to get information out, so that the clients know who to call for this kind of help.
Right.
We could provide them with brochures and such. So,
right. We have brochures, we have the SMP cards, and we also have a flyer with the most recent frauds that are out there, especially related to the COVID.
So if anybody wants, you can certainly email me or Carrie and let us know, and we will get a supply to you, because it's the best way for us to get the information out is through you guys. This is really not about us. This is about the clients getting the information. Terry, you look like you're saying something.
In addition to clients, we have peers who are seniors themselves. We can get enough materials to send to them as well.
Yeah.
Yes,
Let us know your numbers, Terry, how much you want, and we'll get that.
right.
To you.
Yes, we will.
The other thing is, Terry, if it's helpful, Carrie and John or other volunteers can do even a presentation to your case managers.
I think that would be great. I'd love that. And also with our volunteers, especially when we start by, typically we get together with our volunteers for training about once a month. Of course, we haven't been doing that, and as same is true with our case managers. But as soon as we get back into a routine, I would definitely love to have them come and do a presentation for our volunteers as well as our case managers. Although our case managers could probably do a Zoom meeting and it would be fine, it might be a little hard to get all of our volunteers to do that.
Yeah,
Right.
they could definitely do the Zoom presentation like they did. And
Right.
that's for anybody. If anybody has clients you want to do a Zoom event for, or staff you want to do a Zoom meeting or training for, or volunteers, we're doing, I think Carrie and her team of volunteers are doing even like events for the seniors who, it's a great way for them to get the information directly too, if they have what they need to connect. So think about the different ways that we could get that information out, and we'll work with you on that for sure.
And hey, Linda. Hi.
Hey, Gloria.
Hey. As far as if you have printed material that we can hand out, we definitely will come and pick up a supply of information, because our seniors who are driving by through our centers to get their meals, as well as the ones we're delivering to, we would love to get that information out to them that way.
Oh, wonderful, Gloria. Thank you.
Okay.
Yeah, let us know what the numbers are that you need so we can make sure we have that ready for you, and then we can tell you when it's available, or we'll, I know Jeff has come by and picked up other things like the masks and such. So we'll
Yeah,
we can coordinate.
exactly. So I'll have Jeff get in touch with Carrie. Is that okay? Is that good?
Oh yeah.
Okay.
Yeah, thank you.
Thank you.
Yeah. Anybody else have any questions or suggestions or ways you can help get the information out, or even on any other subject matter that we need to talk about while we have you for a few more minutes, for a few minutes?
I think that one of the things that we're going to have to also be very vigilant about is the contact tracing, because we've already had reports of people being, I guess the word is scammed about contact tracing. They don't know how to legitimately determine that this is a real contact tracer contacting them. And it's very easy to frighten seniors into thinking, and I think they're doing this in order to get them to sign up for programs or something but it's an up and coming fraud thing around here.
Do you mean contact through email?
No, calling. They're calling seniors.
Okay.
It's the contact tracing for COVID, right, Terry, that you're talking about?
Right, okay.
Information from them, like their social security number, and and even gone so far as to ask for bank account information. It's obviously a scam, but seniors don't understand. You say COVID and they want, they want to cooperate.
I would very much like to have them of your people who would be willing to talk about that and give us some information.
Okay.
So pick some that are, verbally able to get the message across. I'd love to have them.
Unfortunately, I've got it third hand. I actually had it reported by a volunteer who had talked to a senior who had this happen to her.
Okay.
So, but I just more kind of want to mention it as something to keep on your radar.
Yeah, we'll have to watch for that one.
And Terry, if you could figure out, back trace, if you remember who the volunteer was, and if they could figure out if that client is willing to share their story.
I'll let you know.
Yeah, because then these become ways we can educate other people when we have those kinds of detail, and to let the state know that this is the kind of thing that's happening.
Right.
And I think the best thing we could do as advocates and a coalition of advocates is, as we're hearing about these scams, just like Terry shared with all of us, is to share the information with each other so we can get it out to the people we serve and educate. And even as much education is out there about what to do, what not to do, it's amazing when you're in the moment, the seniors still respond. I was at a workshop a year or so ago in Gainesville, I think, where they talked about the brain and why is it that it's not about intelligence, it's not about dementia, and I think that's a concern that seniors have, is if I play into this scam and they're afraid to tell people. Because they think that now they're going to be considered incompetent or incapacitated, or that they're losing it, and the kids start to worry, and they're humiliated. And it's not any of that. It's the way the brain works, and they're just very susceptible, and the scammers know it. And they just take advantage. And all we could do is just keep the information out there. And as advocates, that's the best thing we could do, is to get that information out constantly. And then when we hear about it, is to report it and then support them, because it's a horrible, violating feeling that they experience. Terry, thank you for bringing that up. And I'd love to hear more about it. I know John does too.
I will send you what I have on it, Linda. Okay.
Thank you, ma'am. Anybody else have anything before we go? Carrie, is there anything you want to add before we go?
Just keep an eye, and anything they hear or know, please communicate with us either through the email or through the phone or through Linda, and we will gladly look into it and report and share anything out there that's coming, because there's a new scam every minute, especially the phone and through the email. One of the things we share with them when it's through the email, if you get a suspicious email, just come out of it and take the name and look to see if you find a secure website for that, to see if it's true or not. Because there's so many offers out there concerning, tests for COVID or help, and most of them are fraud. So it's good to get out of that email and try to search to see if it's a real place.
Yeah, excellent. All right, well, John, thank you so much for that information today.
My pleasure.
Carrie, thank you for bringing John to our group to do the presentation.